Welcome to Talk with Tara, the podcast where we dive into the bold, the funny, and the fascinating. I'm Tara, your host, bringing you unfiltered conversations on life, love, and everything in between. Hit that follow button so you're always in the loop. And now let's get started. Today, I'm really excited. I have Dr. Heidi Queen on with me. She is a concierge doctor at Energize Health and Hormones in Mill Valley, California. She is menopause-certified. She's going to tell us what that means by the Menopause Society, which makes her very unique in Marin. Before I get into everything, I'd like to give you a quick bio. Dr. Heidi Queen is a globally experienced physician, uniquely trained in functional medicine. With over 25 years in clinical practice, including faculty roles at Stanford and UCSF, she now leads Energize Health and Hormones in Marin County, offering highly personalized, proactive care through fee-for-service and concierge models. Her integrative root cause approach empowers patients, men and women alike, to achieve optimal vitality and well-being. She's also one of the founding members and a two-time participant in the Bike Zambia, the largest charity AIDS ride in Africa. Welcome, Dr. Queen.
Thank you for having me, Tara. It's a pleasure.
I'm so excited to have you. Before we get into everything, I want to read a quick disclaimer for all of you wonderful listeners that this episode is for informational and inspirational purposes only. While Dr. Queen shares her personal and professional insights, this conversation is not intended to replace medical, psychological, or legal advice. Always speak with a qualified expert about your unique situation. Before we get into this, can you tell me how you started Energize Health and Hormones in Marin? And then I do want to go over an event that you're going to be having. So let's first hear from you, and then let's talk about this very cool event that's taking place on May 31st.
It's all very exciting. I've been working in Western medicine for 25 years, and for the next stage of my career, I really wanted to put together a lot of the skills that I've been accumulating in order to bring a different perspective to patients. So I have 25 years as a board-certified emergency physician. I've done primary care all over the world with my master's in public health. And during menopause, I was confused by my care and my symptoms, so I became menopause-certified by the Menopause Society. And then I realized I was still missing a piece that I wanted to help with to bring to patients. And that's when I became interested in functional medicine and became trained in functional medicine. And I'm so excited to put all of these together to finally be able to spend time with patients to go over all this and not have a siloed medical approach, but really be comprehensive and feel heard.
I love that because often we aren't heard when we go to see our doctors. We have 10 minutes with them or 15 minutes if we're really lucky, and then we're out. So, but before I get into this, I want people to know that if they want to meet Dr. Heidi Queen, she is going to be having an event called Mimosas and Muscles to celebrate Women's Health Month. It's Saturday, May 31st from 11 a.m. to 1 p.m. She's going to talk about health and hormones, and actually the woman who created Rosebud Women, and she actually created this labia cream that's supposed to stimulate the labia. You may know more about that.
Yeah.
Christine Mason, she also wrote a book. She will be there for a book signing. So that's a really great way to meet Dr. Queen and come into the office and learn about her practice.
It's an amazing way to come and meet other women and feel empowered by people around you as well. We're going to be giving free body scans, body composition scans to everyone who comes so that you can figure out what your skeletal muscle mass is and your percent body fat, so you can see how you need to change that so you can live longer and healthier and stronger. And the woman who's coming, Christine Mason, for her The 9 Lives of Women, is going to be doing the book signing, and she makes some beautiful organic creams that are sourced from Hawaii.
Oh, wow. That's going to be amazing. I can't wait. I'm excited. I'm bringing a few of my friends, actually. We're coming, my little posse, and love to meet other women too, because in midlife, it's hard. We're empty nesting, and it's nice to meet new women friends in these kind of events. So I'm excited to go. We'll bring that up again toward the end, and we'll also post the information of how to get a hold of Dr. Queen's office so you can attend this event. I can't wait to get my body scan. So what drew you to actually, let's talk about functional medicine. You already talked about why you got into this, but what is the difference between functional medicine and just going to my OBGYN, my general practitioner, my different doctors that I go to?
Yeah, that's a really good question. A lot of times it's thrown around that it's just called root cause medicine, but I like to define it a different way. I like to think about it as personalized care that's designed to increase your health span by using everything from lifestyle to environmental factors, supplements, all the way to everything that traditional Western medicine has to offer, including medications and surgery. So it's offering the patients a full course menu in order to be able to match their goals to what best practices is and what's available.
Okay. And what drew you to this though? Like what were you noticing that you yourself, like you said, you had your own journey where you were like, I wasn't getting answers. So is that kind of what drew you to really focus on the whole body?
I think that my work in the developing world, working in Africa and Nepal, Honduras, I really saw how much lifestyle and environment, as well as socioeconomic status, has to do with healthcare and how you can change small things to make a big difference. In addition, my work in the emergency department just showed me throughout the 25 years the transition that's taking place with how everything's becoming so siloed, with having to go to the cardiologist for your heart problems, the gynecologist for your pap smear, and then even being referred to someone else like a genitourinary gynecologist for other problems. And it seems that patients were getting lost in this maze. And in addition, they weren't actually collaborating with each other so that they could get a complete plan of care that could take care of their body rather than things that would contrast with each other. And
Right,
different
right.
answers, it's hard.
Yeah, it's hard when you have multiple issues and your doctors aren't collaborating. And I often tell the story of how I couldn't really get a real answer in my perimenopause journey. I wanted answers and everybody was giving me a different answer. And so I didn't know where the right answer would come from. And it'd be nice to be with a physician where you can get one-stop shop and not have to go to, 6 different appointments to find different answers, and you can't even get the straight shooter. So this is really great. But how would one see you? I know you're a concierge doctor. Can you tell people what a concierge doctor is? But I know that you have a method, or you see patients also one-on-one. So if you're not Dr. Queen's concierge patient, you can still see her. You can do an appointment with her.
Yeah. I just want to go back one minute to what you said, where you're going all around everywhere and you can't find the right answer. I think one of the benefits of functional medicine is that there is absolutely no cookie cutter or right answer for a patient. And it's a collaborative approach between the doctor and patient to look at what's going to fit that situation the best. And it depends on the person's risk benefit status. Maybe some people want to use maca for their menopausal symptoms, and other people feel very strongly that they want an FDA-approved medication. And there's no one who's going to get a score of 100% for choosing one and a score of failure or an F if they choose the other one. It's what works best for the patient, and that's how you get the best outcome. So that's part of functional medicine as well. So the way I set up my practice is that I can have a lot of time with patients. So I have a concierge model where I can be your primary care, and I can cover everything from your pap smear and your mammogram and your cardiovascular disease risk, as well as your vaccines and when you get strep throat, in addition to going over the intricacies of whether or not you need menopausal hormone treatment or even end-of-life care for that matter. Mm-hmm. And I enjoy that. I enjoy the relationship, and I take a limited number of those patients to do that. But I just love working with people, and I want them to have this approach available to them. So I also have single or multiple consults to work on individual issues. And then I love collaborating with their other practitioners. So I would see them and then send out a summary and also notify their practitioners, have a conversation with them, and together help to move their plan forward in the direction. Because at those appointments, I have the privilege to sit and hear the patient, whereas their practitioners who they love do the infrastructure, they may not have that opportunity. But these are all smart, dedicated, caring people. They just can't all do that.
Right, exactly.
Yeah.
Well, I like how you say that. That is true. So what is the difference? I mean, this is a good segue. What is the difference between the compounding? You know, some of the Western doctors don't like compounding. You're a Western doctor. You have both, you know, you work with compounding pharmacies, correct? And
Mm-hmm.
also just traditional pharmaceuticals that you would get at CVS, for
Mhm.
example. Some of the doctors that I've seen, they're like, oh, no. Like I showed them my testosterone pump that was compound and they say, oh, we don't do that. I
We
mean,
don't
if
do
you
that.
want testosterone, you got to get it's like in a ketchup packet and it's a men's testosterone. We don't deal with compounding. You know, it's not FDA approved. They say that to you. But the person that I go to get my testosterone says that there is an FDA component to the compounding pharmacies too. It's not that they're just willy-nilly. So can you tell our listeners the difference?
Yeah. So let's start a little bit before that, why we're in this situation. So we're in this situation for a couple reasons, because we're a country where business is important, and businesses and pharmacies can stay open because they make money and because they're productive. So there's no incentive for these people to spend money testing their products if they're already making money and they're not required to by the FDA. And in no way does that mean that their products aren't valuable or safe or effective. We just don't know. The other difficulty we have is that women's healthcare in and of itself has been neglected for years, with only about 2.3 to 4% of all women's health research being spent on menopause every year. So we have a long way to go where there's lots of medicines that you and I use that have only been tested on men. So that's how we got in this situation where these pharmacies come in order to fill a need that we have that's very valid and very real. In addition, they come in to help with people who have allergies or need different formulations because their gut or their blood or their skin cannot tolerate the FDA approved. So FDA approved medications have to go through a process where they prove their effectiveness to the government and where they also prove that they're not dangerous and they prove that they're produced the same way every time and have the same ingredients. In addition, that they're in a clean environment. Supplements and compounding pharmacies are also regulated. They're regulated by an outside compounding pharmacy board. In addition, the FDA oversees them, but they don't require them to submit the same type of research and verifications that an FDA-approved medicine was. So a lot of times they use an FDA-approved medicine as their element in the compounded drug, but then everything else they put in it is not necessarily approved by the FDA, but then there's usually third-party outside people who approve it. So there's a risk, but there's a risk in a lot of things we do in life. So as long as a patient understands, then that's something they can make a personal choice with. The second thing is that there are some medicines that are just not available for women. Like you said, testosterone. It's available in Australia, and I think in one other country, it is approved by their drug agency. But in the United States, there's no FDA-approved testosterone for women, and it comes in patches for men. We can't cut it small enough for women. So there's a need. There's a physiological reason to have it. And so we have to go outside the system. And as women in our culture, we're used to doing this for many things besides medicine.
Yeah, that's a good point. So why is it that women, you know, when I listen to experts in England where menopause is studied and it seems like it's kind of at the forefront of medicine. It's not the way it is in the US. There are a lot of doctors, male doctors that have a lot of information when it comes to menopause. They say that estrogen, progesterone, and testosterone are three things that women start to lose as they age and that are very beneficial as they get older to replace. So why testosterone? Because that's the one that I feel like our Western medicine has not really jumped on the bandwagon for.
You know, it's harder with testosterone because there aren't as many double-blinded randomized controlled studies. So with a lot of these hormone things, what we know about the female body is your ovaries are decreasing in function throughout your life. And they are part of their body that produces progesterone, estrogen, and testosterone. And this is actually the language the ovaries use to communicate with the rest of your body. So there are receptors all over your body. And we have lots of research that shows us what effect they have. So we have physiological research from animals and from humans that show us that decreasing estrogen affects cardiovascular disease, that decreasing testosterone can affect your mood, can affect how you develop skeletal muscle mass and keep it, how you keep your bone density. What we don't have is we don't have the studies that say you, Tara, need 1 picogram or whatever of testosterone in order to keep your bone mass. Mm-hmm. So in this sense, we're guessing a little bit. And so we're not going out on a limb. We're basing it on physiological evidence, but we don't know. And that's why we have this whole range. And that's why it seems so nebulous for women, because some practitioners start at a very low dose. Some practitioners start at high dose. Some practitioners start at pellets. And the one thing about compounded medicines rather than FDA approved medicines is that it's actually the FDA's responsibility rather to find out if there are complaints or problems with the medication. Where it's the other way around, if a medication is FDA approved, it's the company's responsibility to report complications. So we don't always have, I'm not saying they're cheating and not reporting them, but we don't always have the best records of everything. So this is why testosterone is confusing, because we know its physiological effect on women's bodies. We know it's decreasing, but we don't know the exact dosages that'll give us the clinical reversal or decrease the symptoms you get from it. So things like, let's take libido. A lot of women in perimenopause and menopause have decreasing libidos. But just like the issue of erectile dysfunction, libido is multiple aspects go into your libido, your mood, your relationship, the time of year, if you have lots of kids, if you live in a house where you can have quiet sex, lots of different things, but also your hormones. So a lot of times what we have to do is we have to use a try approach. We have to do things like, you have decreasing libido. I see that your testosterone is low as well. Would you like to try some compounded testosterone? And then I discuss the difference between compounded and non-compounded medications. And we discuss the dose that we'll start at. And then this is why you need a practitioner that you can get in touch with, that you can text with or email, because you have to have communication. So you have to be able to tell your practitioner, this is doing nothing. This is giving me a rash. This is working great. I want more of it. This is what has to happen because we don't have the double-blinded, randomized, standardized, controlled studies to show us the exact thing. So we have to be willing to decide where we want to start and what we want to do and work together as a team.
I like that approach. A lot of women feel like, I was at this party. It was sex for women in their 50s. And they were a group of women in San Francisco, and they were saying they didn't have anyone to go to for this kind of approach. And so this is such a relief that you have an office that can do this now. I can't wait to refer to these women that I met. It's interesting because we're talking about our hormones, and some doctors say that we want to only treat the symptoms, but other doctors say that it's good to kind of slowly replace what you're missing before you actually have menopause. Where do you stand on this?
So for FDA-approved indications of estrogen, it's one for vasomotor symptoms. So that's a symptom relief. It's to decrease the things like hot flashes, night sweats, and not dementia, but the brain fog you get from that type of temperature irregularity. Number two, it's used for genitourinary symptoms. It's approved. So things like frequent urinary tract infections or urge incontinency because the skin around your urethra isn't good. It's used for things like, they call it vaginal atrophy, but where your skin gets thinner and can rip and doesn't produce as much mucus. The last thing it's FDA approved for is actually to keep your bone density. So that's the one indication that we have that's FDA approved for hormones for prevention, is to keep your bone density, because in menopause, you can lose up to 50% of your bone density.
Wow.
during the period. So if you use estrogen during your menopause, then you can keep it. And that's important because one of the big factors of women losing their health, and I'm talking about their health span, their ability to get up every day and enjoy their lives, is if they have a hip fracture or a back fracture or chronic pain from those. So that's an important aspect. So for me, there's also the issue of it's not just prevention by using hormones, it's prevention for all of the things that decreasing conversation your ovaries have with the rest of your body is. So when your estrogen decreases, you get an increasing risk of cardiovascular disease. So part of that prevention is not necessarily replacing the estrogen, but checking your blood pressure, checking your lipids, checking your metabolic disease, and checking your diet and checking your skeletal muscle mass. And that's part of the prevention that I consider. We don't know for sure. There's lots of people who are saying over and over again, like, if you give estrogen, you can prevent cardiovascular disease.
That's what I've heard.
From the Women's Health Initiative, we do have data that says it decreases mortality and morbidity when you use hormones on a long-term basis. But what we don't have, if you use estrogen for year 3 through 5 after menopause, you will decrease your cardiovascular risk of getting a heart attack or stroke by 90%, by 50%, and it has to be at this dosage. So we're using it in hopes that it does, and we definitely think it does. And at the same time, we want to be cognizant that we have to look at the other things in modern medicine and in lifestyle and with acupuncture and supplements that have shown over a long course to prevent some of these consequences of this decreasing conversation our ovaries are having with our body.
It's so interesting, though, because I was having dinner with a friend of mine. She's a dermatologist. And I said to her, "Are you on HRT?" And she said, "Oh, no. They did a study and it can cause cancer." And I thought, wow, I mean, I'm like a lay person and I know that the study was debunked, but my friend is a physician and she doesn't know the study was debunked. How do we get the word out that menopause, I mean, can it cause cancer? This is the fear that most women have. And that's why they don't want. I have a few friends that say, "Oh, no, I can't do it." Or I have a girlfriend who actually had melanoma. She says she won't touch it. I have another friend who has not had cancer, but she's heard about the study. So she's very fearful of it.
Okay. So just like anything we use in life, there's nothing that's perfect and things do have side effects. So some of the main side effects of using estrogen are that you do have an increased risk of breast cancer. You do have an increased risk of endometrial cancer, and you do have an increased risk of getting clots in your legs or your lungs. But when we look at this from the study, you can see that the risk is very low. The increased risk of breast cancer is about the same as drinking 2 to 3 glasses of wine or not sitting on the couch and being a couch potato. So, we choose things based on their risk and benefit. And when we put them in perspective, it's easier to make the decision. So for endometrial cancer, what we do if you still have a uterus is you have to be on the progesterone. Decreases your risk of getting endometrial cancer. For clots, that's a whole nother issue because what we do is we've come up, one of the main advances in hormone therapy over the past couple of years is that now we use transdermal estrogen. And that does not bypass the liver that makes clotting factors. Because when you put something in your mouth, that goes through your gut, through your liver, and then into your blood. And when it goes into your liver, it affects your clotting factors. So by instead putting the estrogen on your skin and having it go directly into your blood and not through your liver, you don't have as big a risk with that.
Okay. Yeah. So it's interesting because I have migraine with aura and my doctor, my neurologist, told me to be on HRT. She said, I said, "Oh, but I have aura." She said, "Well, don't worry about it. You don't have it all the time. And I highly recommend you start HRT." It was interesting. She's the one who actually got me to start it during perimenopause because I haven't gone through menopause yet, but she's the one and told me to do it. And I trust her a lot. And she was telling me the benefits for my bone, for my brains. And she said, if you have the patch, you're not going to have to really worry about that. And I have had no problems at all. So I've been very lucky.
It depends. I have some people with migraines with auras who get them more frequently, who it does exacerbate. But the thing is that if you go to a menopause expert, then they will recognize this. You'll be able to discuss it. And then you can maybe go on something else that can take care of the vasomotor symptoms and also be a treatment for migraines like venlafaxine, which works for both. So the only cure to this decreasing conversation between your ovaries and the rest of your body is not hormones. That's one of the best we have, but don't give up. There's other things.
That's true. So I have another friend who has problems. She has a lot of pain during sex. What are the things that women can take vaginally that help them?
Yeah,
This is something a lot of people have asked me to ask you.
Yeah, no, this is a great one, and I see this in my office all the time. So if you think about it, having pain with sex is multifactorial, like I said, just like libido, but it has to do with your mood, which is connected to your hormones. It has to do with maybe structural abnormalities with increasing scar tissue or things like a vaginal prolapse where your vagina starts coming out of the bottom where your urethra is. It has to do with infections like bacterial vaginosis or fungal infections that make the skin really raw and painful. And it can also have to do with just clenching and increased sympathetic nervous tone. So there are different solutions and you have to do an evaluation. So you need to go to a doctor who's actually going to look down there. No matter what your age, you have to go to a doctor who's going to do a pelvic exam, who's going to feel the tightness in your pelvis, who's going to feel your pelvic wall, who's going to see if you have a vaginal prolapse, is going to see if you have ulcerations or lichen sclerosis, which is like a really bad, itchy, terribly painful condition of your labia that you can get with menopause. You have to look because there's treatments for each of those. So things like lichen sclerosis and dermatitis and yeast infections, there's antifungals, and there's also steroids that you can use locally. Things like just decreased moisture around your labial area, you can use a couple different things. So one, if you just need lubrication during sex, there are lubricants you can use during sex that won't irritate your labia. Secondly, there's great natural moisturizers for your labia. Just like you spend lots of money and time on your face, there's sensitive moisturizers you can use in that area to condition the skin every day. Third, there's estrogen and testosterone that you can use in that area that's going to actually almost remodel the skin or make it better and stronger down there and give you more moisture. And this can also help with women who have repeated urinary tract infections.
Wow, this is so helpful.
So is that maybe it's not any of these and you need to start working on your muscles in your pelvic area. So you either need, if you're getting vaginal prolapse or you're having problems like that, you might actually need Western medicine and surgery and need to see a urogynecologist. But where we would start is with a pelvic floor therapist. And there's many of them in the Bay Area that I work with. And it sounds scary. It sounds like you're signing up for like 1 million pelvic exams every week, which sounds horrible, but that's actually not what it is. They do an initial assessment to see where your weakness is. And then they teach you by different exercises and by using different parts of your body, how to relax those muscles or how to strengthen them.
Okay. So that's good. That's really great. Wondering, so do you also, what about the women's husbands? Do you handle men's health as well at your practice?
I do.
Okay.
I do. I work, part of functional medicine is also working with men's hormones. So I work with men and men's hormones, and I also work with men in functional medicine and primary care. And I have a lot of couples that see me too. They're kind of competing with each other over their skeletal muscle mass %.
Oh, that's good. I like that. I like the couples that go see you together because sometimes the husbands are kind of not in the mood either and they have low T and they've got to work on that. And the women have a place to say, you know, instead of these pop-up clinics everywhere, you don't know what you're getting. You don't know who's on the other end.
Just like with the ovaries, things like erectile dysfunction and decreased libido can be connected to other things like cardiovascular disease or hypercholesterolemia, depression, mood disorders, or even prediabetes. And so those things need to be checked at the same time. And when you go to, a pulling gas station, sometimes they don't check your tires and they don't check your carburetor. So you need to be cognizant that maybe if you treat what's behind the symptom and not just the symptom, you'll have a better outcome and a better sex life for a longer period of time.
Yeah, that's true. I hear all this buzz about our adrenal system. Does that relate to our hormones as well?
Sure. So our brain goes to our hypothalamus, goes to our pituitary, and our pituitary goes down the track and starts creating cortisol, which is part of our adrenocorticoid axis. And that has to do with stress, and what people associate it with is fight or flight. But that same pathway also goes to our thyroid and producing our thyroid glands. And our stress hormones and our cortisol are also part of what our sex hormones are made out of cholesterol. And so it has an effect on all these systems. They work together. And so if you're very stressed, I mean, everyone can see this in regular life. If you're very stressed, your blood pressure goes up, or wanting to have sex goes down, or your ability to control your diet and your insulin resistance goes up. So these interact together. And so sometimes women who see me, we have to evaluate their cortisol levels and what their flow is during the day, because maybe that's part of the problem of why they're having anxiety and palpitations. And it's not their menopause, because a lot of symptoms of menopause and perimenopause are symptoms of many other diseases. So, it's kind of like saying, what causes dizziness? Well, dizziness can be caused by drinking a lot of alcohol, by having high sugar and diabetes. So there's many different aspects. So you have to be able to take a history, do a physical exam, and figure out what's happening with the person to make them feel better.
So that's the same with depression versus menopause. By going to, you can kind of find out the difference. Is this menopause causing my depression, or am I just depressed, having the blues?
That's a little harder.
Yeah.
Because one layers over the other. The other very interesting thing is that this menopause dysthymia, or depression and mood during menopause, actually is correlated with having depressive symptoms beforehand. So what it does is it actually worsens it. Same thing, we're discovering new risk factors of cardiovascular disease. So during pregnancy, if you had hypertension during pregnancy, preeclampsia, preterm labor, if you had gestational diabetes, those are all turning out to be strong risk factors for cardiovascular disease, just like smoking or being obese. So we have to think about, is this just an exacerbation of something that existed before and we didn't recognize it, or is this a new symptom? And either way, some of the medications we use for it can help both. So, some of it is trying something, and also cognitive behavioral therapy works great for a lot of these perimenopausal symptoms and has been proven in studies to work.
Yeah. Oh, that's so interesting. So it's kind of a little bit trial and error.
It is. And the reason why is because all of our bodies are different. Perimenopause is a stage, if you think about perimenopause and menopause, it's a stage that goes through about 30 years of a woman's life. And can you say to yourself, is there a single medicine I can take for 30 years that will have the same effect on my body every single day? And the answer would be no, because your body's constantly changing.
Right, exactly.
And so it's the same thing with hormones and for treatment for perimenopause and menopause.
Yeah. So I know you're not, speaking of that, I know you're not an endocrinologist, and, you look at the whole body, you're a functional medical doctor. But a number of my friends wanted me to ask you this question about Hashimoto's disease, and that is when your immune system starts to attack your thyroid, and it starts to not function. And your thyroid does a lot of things. It regulates your metabolism. It helps you with whether you feel cold or warm. And it does a lot of things. So do people who have Hashimoto's, or they just lose their thyroid and they can just take medicine for the rest of their life? Is there a way to get your thyroid back and running? Because there's all these books on how to get your thyroid fixed, and I don't think it works.
It's interesting. In perimenopause and menopause, there's an increase in autoimmune disorders among women. And so one of the things we like to test is antibodies against your thyroid. So what's happening in Hashimoto's disease is your body is attacking your thyroid. So in that sense, what we can do is we can slow the process by supporting the thyroid, but I haven't seen any research that says we can reverse the process. But with good care and using things like iodine, zinc, selenium, checking A, D, checking your cortisol levels, which actually make your thyroid work overtime, thinking about decreasing gluten and dairy and wheat from your diet. There's different mechanisms you can use to make your thyroid have the most supportive, comfortable environment so the cells are the most resilient.
Okay.
And won't be affected as much. Because some people even have these antibodies and they never have to go on thyroid medications.
Oh.
Other people, it increases throughout their life and they need more of the medication or even a different medication.
Okay. So people can just take the medication for the rest of their lives and survive?
Definitely.
Okay.
It's very rare that you die of Hashimoto's disease. There are episodes of Hashimoto's disease where your thyroid T3 and T4 can go super high and you can have a crisis, or when you can become very, very hypothyroid and have a crisis. And both of those are dangerous, critical conditions, but they're rare.
Okay.
And so most people, it's like living with diabetes and having to be on insulin their whole life.
Okay. Okay. Got it. Well, gosh, Dr. Queen, this has been amazing. Can you tell people how to reach you? I will have this in my show notes, but tell us how they reach you for your office. And don't forget, May 31st, we're going to be going to this really great event. I'm excited. I can't wait to get my body scan. It's Mimosas and Muscles. I love it, to celebrate women's health. So it's Saturday, May 31st, 11 to 1 p.m. I hope to see you there. If you do join, say hi. Can't wait to meet you. But can you tell people how they get a hold of your office so they can go to this event?
Come to this event. It's lots of fun. You'll learn something good about yourself that's going to make you live longer.
Yeah.
So you can call my office. The number is 415-548-7901, or drop by anytime, even if it's not the event, to say hi, or at 655 Redwood Highway, Suite 200 in Mill Valley. And you can find us at our website too, which is www.energizehealthandhormones.com.
And I'll be putting this on the website. And it's for those of you who live in San Francisco and Marin County, it's right by the Piatis on the freeway. It's so easy to get there, easy on, easy off. Plus, you can go have lunch at Piatis after.
Thank you.
Yeah. Well, thank you so much. Thanks for this informative, wonderful session for our listeners. I'm sure they're going to love it.
Thank you for having me. I appreciate it.
Thanks for listening to Talk with Tara. If you loved today's episode, please follow the show and share it with a friend. Stay tuned. There's so much more to talk about. See you next time.